Does your diet and nutrition play a role in your risk of cancer? Well, Dr. Megan Indermauer is back, a gynecologist oncologist with Women's Care Florida, to share how improving one's diet can actually reduce your risks of cancer. Welcome back.
Thank you. I'm great. How about yourself?
I'm doing well. And this is a topic, of course, I feel like every day there's something like eat this, don't eat this, this causes cancer, this doesn't cause cancer. I mean, it absolutely can be overwhelming. So I'm glad we're talking about this. What do people need to deal with? What do people need to keep in mind as they're living their regular life?
I agree. It's completely overwhelming, even for me, even talking to patients every day about diet. I think the most important thing to understand is that you have to make lifestyle modifications in order to reduce your risks potentially of cancer. And if you're actually a cancer patient, those lifestyle modifications can make a huge difference with regards to survival as well. There are a lot of books, internet articles looking at diet, and it's extremely difficult to kind of weave your way through that. Yeah. The most important thing is to reduce the amount of fat in the diet, the amount of simple sugars in the diet, so simple carbohydrates, pastas, potatoes, and reduce the amount of red meat in the diet. Those things all can increase obesity, which increases the risk of cancer. So the only diet that actually truly has been studied in the cancer world is the Mediterranean diet, which has all those qualities. They have complex carbohydrates with brown rice and big hearty grains. They eat mainly white meat, lots of fish, olive oil, things that kind of keep you healthy. You want to stay away from processed foods. Those all kind of, from a number of ways, increase inflammation, increase fat, and lead to obesity.
And so that's more what you see is when you're talking with patients, the obesity is what really can, I don't want to say trigger, but can possibly complicate or make worse. Am I understanding that?
Yes. So actually obesity increases a number of different cancers. It's a extremely high risk for endometrial cancer, as well as breast cancer. In men, it's prostate cancer and colon cancer, as well as a few others. So if we could watch our weight, decrease our weight, then that's probably one of the best things you could do for your health, not just from a cancer aspect, but also heart disease and other diseases as well.
Overall, we were talking about lifestyle changes, but of course there's still that factor, and maybe this is something else we hear in the headlines, the genetic risk of getting cancer. What do you see in your practice, and specifically ovarian cancer? What do you see as far as genes go when it comes to?
So about 10 to 15% of cancers will be hereditary, meaning that it will be passed from family member to family member. Specifically with ovarian and breast cancers, the BRCA genes, we hear about them all the time, but there's also something called Lynch syndrome, which is a hereditary gene abnormality also that leads to endometrial cancer, ovarian cancer, and colorectal cancer. So we can't necessarily modify the genes, but you can modify lifestyle to hopefully help prevent potentially those cancers if you are at high risk for them.
If people do think that they're at high risk and feel that they've got some symptoms, going ahead getting checked now, is that the best advice you'd give?
Getting checked, changing lifestyle, as I've said multiple times, which is not just diet, that's also increasing physical activity, which you have to do, especially as you get older. More activity is going to help you lose that weight.
You know what? These are good topics. Thank you so much. And again, I know we've touched on it in previous segments, but it's a whole umbrella. You can have a gynecologist in Women's Care Florida, and that can just lead you right if they have to have you and have to have the surgical elements that you're able to provide. Again, this was so nice talking with you today. If you want more information on anything that we discussed today or have any other questions dealing with women's care, we'll of course get in touch with the fine folks at Women's Care Florida. There you see all the information on your screen.